Good evening. My name is Dr. Guia Calicdan-Apostle, and I'm going to present an abridged version of a presentation that I did at Philippine Association of Social Workers Incorporated uh, online last June 12 or 13, that's Philippine time. And I would like to start by looking at the mental health needs of social workers and mental health practitioners while in the midst of a global pandemic Philippine setting. So a little bit about me. I'm an associate professor of social work at Stockton University, and I teach in the MSSW program. And I was born and raised in the Philippines, obviously, and I did my field work for my bachelor's and master's degrees in Philippine Women's University as well as Asian Social Institute. And I received my doctorate in clinical social work at the University of Pennsylvania School of Policy and Practice. And of course, I passed the Philippine Social Work Licensure exam, which we have, just like in the United States. And I worked as a junior faculty at Asian Social Institute and at UN High Commissioner for Refugees. And I also was an intake worker when I came to America with Ethiopian and Eritrean refugees in Arlington, Virginia, and also worked in the prison system, developmental disabilities, veterans, so school social work in K-12 school district, and field director of American Stop Smoking Intervention Study for the Prevention of Cancer, which is an NIH grant fund. So before I start, um, I'm trying to put this into a perspective of how I look at my cultural nuances in relation to the pandemic and presentation to the Philippine social workers. And when I presented this, I always look at the CSW EPAS competencies and practice behaviors. I always think that we have to start off by looking at ethical and professional behavior and being much more self-reflective and looking at self-regulation to manage personal values and maintain professionalism in practice situations, as well as engage in diversity and difference in practice. So some disclaimers, this presentation will not give you advice to substitute any modalities of intervention that you're currently following. In other words, wherever state that you're in terms of mental health issues, you are your own expert and you need to, and I am not your therapist, but we are trying to unpack some of these issues on mental health in relation to social workers while working in times of the pandemic. You are in a safe Zoom space. And I always say that, however, if you feel uncomfortable at any time during and after this lecture about the content that this is discussed, you may seek the communication with the organizers who can also advise you to seek professional help. This is a lecture that is based on theories of social work and current practice, and the views of this presenter does not represent the views of Stockton University. That's always the case. Okay, so, and to the best of the knowledge of lecturers and organizers, there are no intentional or specific images, content, and analysis that can harm your emotional and psychological well-being. When it comes to copyright issues, I use some of the images that are coming from, that are copyrighted, so I'm also acknowledging that. So the abstract would be, it's basically this. This presentation will discuss culturally responsive interventions to address the mental health of the Filipino workers as they continue to deliver services to those who are affected by this pandemic. And we're going to look at the practice as well as potential post-pandemic recovery based on macro, meso, and macro perspectives. I just want to say that with humility, I am delivering this to the Filipinos, and they are from north of Luzon as well as down south of Mindanao, and they were comprised when I presented this. There were about 600 plus social workers, members of PASWI, as well as there were over 3,000 uh, views afterwards. So I want to say that this is this issue is an important topic, and it's addressing the mental health needs, and it's a topic that's difficult to discuss, especially in the Philippine setting. And this mental health issues does not really refer to our clients, but we want, and with some humility, we want to talk about us, social workers. As I've said before, you're in a safe space, and I admire social workers, in any setting with American social work as well as Filipino social workers, because they're like angels that walk upon this earth, and we are the good guys. We are the good people who are trying to help humanity. For this presentation, I will be presenting uh, with a combination of English and Tagalog. Tagalog is the national language of the Philippines, as well as English, so that there is more efficacy in terms of communication with the Filipino social workers. So today is your day, and I would like to invite you to participate in this session. And of course, please have your papers and pen, no interruption, please pay attention. And if you miss some parts that are connected to the main points, try to incorporate your ideas into our discussion later on in chat, and to have also a quiet spot if available, because we're going to do some kind of activities that are interventions that are efficacious when it comes to meditation and um, all other modalities that will relax you. And then please stay throughout the entire session, ask questions. We can learn from each other. I am not necessarily the expert. I am facilitating the process of what you know and what we can put together based on experience in the field as well as in the classroom. And sit in a comfortable chair. Confidentiality is definitely practiced here. And if you are going to present a story or some kind of issue, we assure you that this is all confidential, and we also exercise that we do not reveal, some parts of it, and you don't have to while we're on chat. So the outline of the presentation is this. I'm going to talk about the facts of coronavirus and the good news about this pandemic. We'll see self-care approaches, and there are 3 of them. Culturally responsive interventions in introduction to 4 evidence-based interventions, which are going to be kind of incorporated together. And then the salience of spirituality in the midst of a pandemic. Now, when we started this PowerPoint or presentation or webinar in the Philippine setting, we started off with a prayer. And it is just fitting to what we know culturally in the Philippine setting, because the Philippines incorporates spirituality and faith in their activities. And unlike the United States, there is a separation of church and state. But in the Philippine setting, we welcome all kinds of religious and spiritual expression before and after meetings. And that's always been the case as far as I know. So again, we're going to start, and I want to assure you that you're in a safe place, and you're in the company of social workers, and we're going to learn together. And I want you to be happy, because we need to find this happy medium between the pandemic that's going out there, as well as what we're trying to do as social workers in terms of self-care. Let's see. So part 1, what's COVID? So how do I know? First of all, whenever I start a session, I really want to think what you're going to get from this session. In other words, what do you really want to know today, right? Because this is about mental health care. So I thought maybe I have a few questions. So here are my questions. How do I know that I have a challenge or a problem? I try to not focus on problem, because it's not a problem yet. Yes, maybe we're having some challenges, but not a problem yet, because we don't know. right? What knowledge do I need to survive this pandemic? So knowledge. And then what skills do I have to survive and thrive while I am working from home or while I'm in the midst of this pandemic as a social worker? And what does self-care really mean to me? And this is why we're talking about this. This is the time to really focus on self-care because of this pandemic situation. How should I apply at least three culturally responsive evidence-based or evidence-informed interventions to elevate my self-care? I kind of operate on the fact or the assumption that you do have some self-care skills. All right. So now what I want to do is maybe elevate that experience and maybe uh, discuss some of these evidence-based interventions that will help us, uh, you know, kind of solidify our self-care program. Okay. So why the coronavirus is confusing to us? Is it a germ? Is it a flu? Over 3 million people have been infected in 4 months worldwide. So I'm presenting this now, but when I presented this originally, it was in June. So it was a different time. Of course, there are more than 3 million that have been victimized by this coronavirus. Governments closed down, all global and local businesses stopped. Families, friends, and anyone you know remotely may have or are infected or may have been infected. Healthy people got sick and some died, unfortunately. And most people with health issues over 60s and above are usually infected, but demographics are changing based on many variables. The healthcare system is not prepared to take care of a massive number of patients, Philippine setting as well as American setting. Now, is coronavirus a disease or a virus? SARS-CoV-2 is the virus. COVID-19 is the disease that it causes. Some are asymptomatic and some can get the disease even after survival. The case fatality rate is dependent on the person's pre-existing conditions, the ages within the population, how far people live from hospitals, how well staffed or equipped these hospitals are, and the ability to pay, having insurance or no insurance. So, there are different reasons, uh, not only in the Philippine setting, but also in the American setting. So now, here, let's get the facts straight because some of the information that we're getting are coming from Facebook, which may not be reliable. Remember, we are trying to approach this based on science and art, right? Because we're social workers. So here are the facts. Ventilators are not a death sentence. So when I researched this, 25 to 50% rate of mortality before, but contrary to early results, a 75% to 80%. So ventilators, people say, oh my gosh, when if you're on a ventilator, it's done. Like, it's not. All right. COVID-19 survivors are not immune to the disease. Okay. So in other words, just because you got it one time, or maybe this idea of herd immunity, we're going to talk about it a little later, may not work. And blood types do not play a role in surviving the pandemic. Some people say if you're type O and you're a female, maybe, but not blood types. Okay, that hasn't been proof. We have yet to see strong evidence of that herd immunity. And I know for a fact that um, Sweden, I believe, has been practicing this, but with some not so good results. Okay, do they really work? We don't know to today. So, lack of access to hygiene measures and behaviors that do not promote social distancing increases one's chance for COVID-19 exposure. That's already a fact. Surgical and N95 masks are better than homemade masks. Of course, homemade masks are better than not wearing masks at all. And that's very, very controversial, right? Symptoms of COVID-19 hospitalization to serious, which does require hospitalization and care. And there's no evidence that hydrochloroquine is presented as cure for COVID-19. So I guess we need to really unpack this a little bit. When people say, or some people from certain parts of the world say, well, that works. Well, does it really? So we need to show that there is enough evidence using science. And that's very important because it's about our health. One death is as valuable as many, and I hope that we do not have. However, because of not so great practices from different parts of the world, then there are different results. The good news is there are no signs of alarming mutation at this time. Okay, and vaccines may be available early next year. Now, I know I'm presenting this in September, and there has been some growth in that in terms of development of vaccines. However, if one really looks at science and protocols, it really takes some time. So I don't have a crystal ball and I don't have the answers, but hopefully we will find more answers in the very near future. The not so good news. Of course, there's social distancing, which is physical distancing, but it doesn't really mean that you don't have to communicate with your loved ones and friends and colleagues. What happens is in the Philippines, it's really depriving the Filipino people of not meeting families and relatives, especially during the weekend, the Sunday lunches, the picnics in the park, and getting together in the beach, so that's the same thing all over the world, right? However, it doesn't mean that if we are physically distancing, we're stopping the social distancing, we're stopping the social communication. So I think we need to really make sure that we communicate in any way, shape, or form. Now, in the Philippines, we're very good with Facebook, with IM, text, right? In the United States, of course, it's calling and some Facebook and mostly texting and calling. Now, how does this look like in families with multiple generations and living together under those challenging conditions? Not so good because what? We're talking about economic inequality here. Some people, especially in the Philippines, with multi-generational families living in one or two bedrooms, right? Closed homes, closed areas, and it is not easy, and definitely it is a problem. It is a challenging issue. Now, also, how far are we from the hospital? So how are we going to get our needs met if we're far away, especially in the rural areas? And what is our survival plan? What is your survival plan, right? So here are the factors to determine mental health, right? So what I did here was I tried to ask myself, how do I know that I may not be okay, right? So this is just a draft of how things look like that may not be regularly what you are. So I try to categorize the symptoms or the manifestation of things that may not be as normal, depending on the gravity, depending on the rate, and the extent of these symptoms. For example, the physical, right? Maybe before COVID, you already had hypertension, you had sleep disruption, right? But maybe now it's much more heightened with problem that compromises your immune system, maybe some alcohol and prescription drug consumption, which are more now than before. There's weight gain, weight loss, and cannot taste food. Now, of course, we know the data on not being able to taste your food, and people say that that's part of coronavirus symptom. Now, at work, there's been, maybe problems with shame or guilt, lack of engagement with colleagues. We don't know. Pandemic really hits everyone, and it is affecting everyone in different forms. So this could be one scenario or one symptom that could be happening. Now, based on emotional and social interpersonal issues, maybe there's raised anxiety, fear because of obviously the pandemic has been handed down to us, right? And there are different anxieties and fears that are attached to it. But what's normal and what's not normal because of the heightened experiences that you're having really needs to be understood. So there's shame, emotional numbing, cynicism, mood swings, and of course, at work, there's also poor self esteem, burnout, cynicism, and vicarious trauma. Now, I highlighted burnout because it's really a very huge issue even in America, in the United States, right? Burnout means not you don't care anymore what the job is all about, and you're cynical, with clients. It's really showing up that you are not really trying your best. Now, vicarious trauma is just as well similar to burnout, but it is a little bit more, especially when you have experience some difficulties after you have met your client in the field and has had tremendous issues with abuse, violence, and all kinds of issues that you internalize them and they come out in different forms. An example of this, I have stated an example of this in my previous presentation. I have worked in different settings that I have already stated, but the most difficult time that I had was counseling a mother whose child was raped by her boyfriend. And it came out because I was working in a school setting. I realized that the child was nowhere to be found. Apparently, he was absent. And then, but prior to that, the teacher has reported to me that there were issues inside the classroom. And I finally was able to get in touch with the mother, and she came one afternoon at the end of the day and flopped to my chair and sobbed and cried and just expressed all her frustrations and anger. And for 3 hours, I listened in detail what has happened. And the child was raped by the boyfriend. And that day, when she presented this case or herself, she had two deaths: the deaths of her not inability of not uh, protecting her child, her 5-year-old child, and of course, her love for the boyfriend. So within these 3 hours, I listened to her, and towards the end, I was actually very exhausted. I had to ask to step out for a while because you can't present yourself emotionally in front of a client. And I went to the bathroom and I just started to cry. Then I gathered myself together, and I'm trying to do this with transparency because it is normal. Went back and I tried to kind of like gave her a checklist of what needs to be done, and so that she can be helped. Now, for the next 4 days after that, well, 4 nights and 4 days, I could not sleep, I could not eat. And then towards the end, it was only my spirituality. I cried, I thought about how the world was like. But towards the end, I decided that I'm a social worker, and also I have my own spirituality that will help me understand these moments that have been difficult for the client. So that was an example. And then of course, mental, psychological um, things that you may present, depression, symptoms of depression, not depression. Remember, we cannot actually diagnose ourselves. Okay. Of course, if there are 3 or more symptoms, then you will try to seek help. Rage, avoidance of reminders about client trauma, right? So if it's lingering, intrusive thoughts, and hearing voices. And from the religious perspective, there's also cynicism, shame, or guilt, because you used to some social workers used to believe in something, and then all of a sudden they got shattered because of these traumatic experiences that you hear and you experience with your clients, as well as your belief in the world, your belief system that have been shattered. So there are concerns that we have and questions that we have about coronavirus. Going back to this, coronavirus symptoms. Yeah, do I have it? Don't I have it? Death toll rising. Is my family going to be okay? Aging parents. Will I continue to have a job? More layoffs, right? So that's really an anxiety raising situation or thought. Will I continue to have a job? How will I pay my bills? Am I sick? What if I am asymptomatic, right? So these are the concerns we have, which are logical. So I want you to take a look at this worry scale. And I said, I tried to pull it out from the computer, and I thought I could not put a scale on it. But if this is a worry scale, where would you be now, right? So I would like to give you maybe a minute or two to think about where you're at. And when I discussed this with the Filipinos, by the way, on chat, most of them were in moderate, some severe, some mild. But never have I encountered the social workers when I facilitated this discussion on the severe or worst pain possible. But this is very helpful, right? You're locating yourself within the perspective of where you're at given this pandemic. And I think it's important to think logically about that so that you'll be able to find yourself and say, okay, am I here? What am I going to do? Right? So while you're thinking in this way, I kind of want you to, ask yourself, what do I have yourself in order to survive this pandemic? Right? So the questions I have is, do I have a philosophy or pedagogy in life? Do I have a mantra, a proverb? Do I have a belief system that's very strong within me? A code, right? A personal code, or maybe a family code, right? There's a family honor in the Philippines. Like, you don't humiliate your family. So there's also a family code. What can you do and you cannot do? I have a prayer to those who would like to use their faith or spirituality. A song, right? A poem, or some would probably look at this from the perspective of what you have, maybe growing a garden, some skills level that takes you away from this pandemic or from some kind of stress. So for this exercise, you may write down maybe one or two. If there's a song in the line that plays, you can write it down. So what I like to say here is, I look at life, and I hope you do, uh, glass half full, where people live more and fulfilling lives, versus glass half empty, right? So it depends on perspective, and you can later on look at some of the experiences and the views of people who live more fulfilling lives. Why do I have to think about a glass half full, glass half empty? It's because whenever we're challenged with difficulties in life, we can also take a look at what we have and what we can do. And it's so difficult to stay in a place where it's unsafe and uncertain, versus maybe you have something that you can cling to be able to pass that experience of feeling being down and low, right? So in surviving can be those difficult things, but also it some of these things can help you, right? So let's see. Let me move on. So thoughts about sickness or wellness, right? Do I want to just stay on this side of my frame of thought that the world is gonna end, right? Or do I say, well, you know what? I'll be able to maintain myself a state or a level of equilibrium, homeostasis, where I can function within this, you know, things that are going on in our country, in our families. So you also have to think about chaos versus calm, right? Which one, right? Yes, no, maybe, right? Or do I have to be calm? All right. So death is real, right? You're trying to think about this pandemic as doom and gloom, but at the same time, and it is, right? I mean, it is to a certain extent, and death is real, but do you want to go into a place of hopelessness, right? giving up easily? Should I go to a place of sanctuary, a place of hope, and a place that potentially you can heal, right? Because you're a social worker. It's not just your personal life at stake here, it is your professional life to be able to function as a social worker, right? To be more positive and hopeful, and hopefully influence your clients to do the same. Now, now, of course, here it is. How will I make it? So it's just like the gazelle being, are you like a gazelle running because some tiger is running after you? The, the good news is, I don't want it to be a good news, but we're mostly all in this together. We're all in this pandemic. There is no exception, right? It's how you proceed and how you can positively think. Because I believe that all the cells in our body are influenced by the way we think, and it has a positive effect. If you think, if you think positively, and that's actually what I teach in CBT, right? I actually, this is just a plug in that I started a course on cognitive behavior therapy. The thoughts really, it makes a difference, right? So the same thing. We do you want to be grounded on earth and think calmly about this experience, and because of the idea that you may be attached to the physical realm of this world, but there's also something going on in the mystical, in the spiritual realm. And that is very true, based on the cultural nuances of the Filipinos. So while this is happening, you also have to think, and we also have to think, well, is there inequality in this pandemic? Yes, of course. If you think of the pictures here, the one on the left will have a better chance of surviving than the one on the right? Depending on those variables that has to do with economics, right? Those who can make it and those who have more space to free up so that they can socially distance and isolate themselves when they are sick, crowded spaces. So this is something to think about when you discuss inequality in times of the pandemic. The third part that I'd like to talk about now is the self-care and culturally responsive interventions to self-care. Now, I took a look at self-care in the Code of Ethics, and the International Federation of Social Workers was able to unpack social self-care in this regard, that social workers have a duty to take the necessary steps to care for themselves professionally and personally in the workplace, in their private lives, and in society. So that's huge. That is sometimes burdensome, but we are social workers, so we need to step it up, right? Now, I also look at the National Association of Social Workers, and they embedded it, it's incorporated in the supervisory relationship, that supervisors need to pay attention to signs of job stress and address them with their supervisors and themselves. And they should provide resources to help supervisors demonstrating symptoms of job stress and make outside referrals as necessary. And of course, peer consultation can be helpful to supervisors and supervisors in such class. An example that I would like to mention here is in the United States, if a person has a problem with alcohol or other issues that have that are related to mental health and physical health, you can actually discuss this in confidence with your supervisor or your workplace. And it is illegal for you to be, to not to lose your job just because of this. In other words, if you're taking care of that situation, then it is there, and if the HR human resources is able to help out, and you're being transparent about your situation, and there's an opportunity to heal in that process because of your right as an employee. Now, the Philippine Association of Social Workers has some limitations here. And I mentioned before that in looking at the PASWE Code of Ethics, there seems to be some difficulty in unpacking this with self-care. However, I was able to talk to the president of PASWI, and they're working, and I'm hopeful that I'm going to contribute to this, but we're working on this to write up a more robust statements on self-care. Now, what is the problem coming from? And I want to discuss this specifically, this compassion fatigue, right? It is important for us to be aware whether we have it or not. And I'm going to present the scale later on, this compassion fatigue in relation to self-care. Compassion fatigue is a set of physical and psychological symptoms that appear in social workers when they are exposed to client suffering, just like what I have mentioned before, and that's also trauma, as well as, being desensitized to some of these things and issues that are coming on to you, and then you're not able to help the client. Now, you need to also, in this sense, to know about self-care. What skills do I need to survive and thrive while under this pandemic? You usually think about thriving before, right? But now with pandemic, you have to think, we kind of shifted from surviving to thriving. And it's not easy to do that because we are on this in the same plane level of the same pandemic. Now, we also have to think about our sphere of influence. You know this already, but that you are you're the one in the circle, the one circle in the middle, kind of like below, as it cascades up to the higher level of relationship with structures or with institutions. Okay, you are influencing them, but this is on the basis of your location, your privilege, and power. This is very important because we know already that we can influence our partners, our wives and husbands and children, and then of course the extended family in the Filipino setting, right? If you are the kind of the leader, of the Filipino family, or maybe you are also following because of the hierarchy in terms of age, in terms of roles and functions. And then, of course, friends and neighbors, if you have a certain role in the community and they look up to you and so on. And then, of course, as you go to the employer place of employment, school setting, or professional acquaintance, you also have a place. So as you go up the line, it cascades as to your level of influence from the self to the family to the structure, to the organization, to the community, and to the institution that you are working on. And while you're thinking about this, you also have to think specifically what your circle of control is versus your circle of concern. This is nothing new, right? So your circle of control, yes, you can control where you work, what you read, what you do, what you eat, maybe your leadership position because you are given that responsibility and that's formal position in an institution, places you want to travel, but now no more, right? But you can't control that because of the limitations of the pandemic. Your attitude and enthusiasm based on the functions and roles that you have. Now, of course, that's your level of control, right? The small circle of control and large circle of control are two different things, right? And there's a lot of time and energy that you that you expend to be able to control your situation based on the issues that you're trying to work on. Now, the circle of concern is a little bit different. So how people react is based on where you live, right? Where you work, what you read, what you buy, and then your circle of concern could be kind of like it's controlled by what's going on outside of which you cannot control. Obviously, the news, fake news, for example, is this fact or fake, right? Political views of other people, the disasters and of course pandemic, right? It's you cannot control that. And what other people think of you, the weather. Of course, there's only two kinds of weather in the Philippines, right? And then wars, weapons, terroristic threats. You can't control those things. The lives of people and celebrities, and so on. So these are important components of what you think about, how you think about yourself within this scope of the pandemic. So to to explain that further, incorporating the two things that I have just discussed, I would like for us to focus on the three approaches to individual self-care. And here are critical points for discussion. One is self-awareness, next is self-efficacy, and then self-regulation. I'll discuss that as we move on. Oops. All right. So self-awareness. We know, alam kong alam nyo to, right? So when you were in your bachelor's program, you talked about Johari window, right? The four windows. One is you're open to self and to others, which means, oh, you're open, you know what's going on, and people know about you, and you're showing off yourself as to who you are. And there's the blind one. You don't know things about yourself, but other people know about you. Usually, those blind, if you focus on yourself, but people don't know about it, right? It's kind of like the mirror. The mirror is pointing at the people who are talking about who you are, right? And the hidden one is you're known to self, but not to others. So there are things that you have not revealed about yourself to others, which is okay, right? I think we need to be kind to ourselves because this is a process and this is a theory, this is a framework that it's not perfect. And we go through certain processes in our lives, and there are things that we have different levels of comfort. Now, unknown to others is not known to yourself and to others. But really, the bottom line here is this: that authenticity, you have showing authenticity and looking for that authentic self is important. And to be able to do that, you need to require self reflection. And that's really the key element in becoming more self-aware. So sa Tagalog, pagkala ng sarili, right, which is I need to talk about cognitive consonance, right? Authentic self in relation to the reality around you. When we talk about cognitive consonance, it's a state of harmony and internal consistency arising from compatibility among a person's attitude, behaviors, belief systems, and our knowledge, right? So it has to jive, magkakatugma, right? Yourself as well as how you view reality. Now, there is this thing called cognitive dissonance, and I'll give an example. Okay, COVID-19 kills, but I can choose not to wear a mask. Now, unless it is the law of the land, then you cannot. Of course, there are repercussions to you not following the rules. But the cognitive dissonance there is, my gosh, we know that COVID-19 kills, and we know that putting on mask will help us and help others. But why are we not going to do it? Right? So that's kind of cognitive. It does not jive. Cognitive dissonance. It's almost like that belief is so flawed. Another example here is smoking. We know already as a fact, based on science, that if you smoke, there is going to be some repercussions, cancer, emphysema, and all kinds of other health issues. But people still smoke. So that's cognitive dissonance. So when you try to think about your authentic self, you have to go within the realm of cognitive consonance, that your internal system, yourself, should jive or should connect with your attitudes, behaviors, and belief system and the external reality. Okay, that's in harmony with your own belief system. Now, authenticity, and I kind of made it up like an upside down triangle, and I'll make a point. So, authenticity is when you think and act according to your beliefs and values, regardless of external pressure, right? Why not? Uh, in the Philippine context, this is not easy, right? When you talk about groupthink or following what the family wants, these are challenges that we have. And I'm going to talk more about it. Let's start from the bottom. Pag sinabi natin ng authentic, wow, ang galing ang ganda ng dating ng authenticity. Like, okay, those clothes, oh, is that the clothes from, Calvin Klein or some other signature models, right? apparel, shoes like Gucci bags, and all that's like totoo ba yan? Is that for real, right? And then when it comes to customs and traditions, right, you look at something that's really authentic, like wow, Barrio Fiesta, or you go to some parties that have the traditional customs and traditions that are being presented, and you're happy about it because they are authentic. Or you go to places that are just like copycats, and that's disappointing, right? So but you're seeking for something authentic. Now the most important part of authenticity is this belief, personal beliefs and values. So what are you made of, right? What do you want? How do you see yourself being authentic? Now I want to kind of reveal myself a little bit, because I have been living in America for quite a long time, and I have raised my children here. And a little reveal, just to make an example, to point out an example here. Raising my children, as a single mother, right? I have to streamline my values, okay, within the values of how I see myself that fits well in raising my children, right? Okay, as long as the value systems are not hurting or harming anybody, as well as my children, I think I can live up to these value system. And I think that's really important. Like nobody should die because of your values and belief system. And that to me, based on how I see myself, is within the realm of authenticity. In other words, I I have values that are Filipino, and I also have some values that are Americanized in terms of independent thinking and being much more uh, um, yeah, how do you call this, expressive in my thoughts and feelings about things. Whereas I grew up in a household where women, and I'm trying to be not feminist here. I don't want to be apologetic, but being a woman, has its flawed based on how I was raised. Maybe not you. Maybe you were raised differently. So I'm just thinking this has changed in certain ways, and I have found my voice, and I've found that my perspective and how I look at life based on being a woman, and that's a strength by itself, and that's a value that I am able to uphold and teach my children, especially my daughter. So I think that's really important. So there it is, authenticity. So I kind of want to talk to you a little bit about what Socrates have to do with COVID-19. And I want to share this quotation coming from him. The secret of change is to focus all of your energy not on fighting the old, but on building the new, right? COVID is new, right? It is sad, but we actually have to think about how do we move forward, based on what we're confronted in, right? What are those possibilities that we have, right? And social workers have the head and the heart to connect themselves to be able to act upon these things that are true and meaningful and professional. And we are the kind of people that kind of, like, if you talk about Freudian's ego and super ego, right? But the more super ego, right? I have not seen, maybe one, I would say, in my lifetime here in the United States, one person in the news, one social worker in the news, but I have not seen, social workers in the news committing crimes. We are the good people. We are the ones that anchor some of these things that are good for humanity, and I think we have the capacity and the ability based on our profession to serve humanity and to express what is right, what is true, and what is meaningful for humanity. All right, so I'm going to present a little bit about compassion fatigue scale, and I thought maybe a little exercise for you here. Now, the framework here is, if you feel feel this more often, it means that you do have a situation, compassion fatigue, obviously. If not, or never, or rarely, then you kind of like you're in a one or twos or three. So I highlighted some of the things that I thought may be important for you to think about, right? So one is I have thoughts that I'm not succeeding in achieving my life goals. So where are you at there, right? I have had flashbacks connected to my clients. That's not really a good um, uh, how do you call it, a symptom, not symptom, but manifestation of what you're doing in the field. And I feel that I'm a failure in my work. So if you look at these, if you examine this further, you'll see that there are things or symptoms that may occur because you're always there trying to give and give, because you're kind of a caregiver. You're always trying to bring hope to people, yet maybe you have a self sense of hopelessness. So that's not very good when it comes to this scale. Now, I'm going to talk about self-regulation, pagpapatupad ng sa sariling. I know I had a difficult time trying to put this in Tagalog because, and I had to have help from some friends, in the Philippines. I especially thank Sir Roy and Cleo and Penn in helping me put this all together and facilitating this process when I presented it to the Philippines, for the Filipinos. So self-regulation is this, and you can take out your paper and pencil and work on it. And some of these things I highlighted in some bold features here. One is I learn from my mistakes. Now, yeah, that's a very good point. Why? Because it gives us a sense of ourselves functioning, that we are not perfect human beings, right? We make mistakes, and but we are able to acknowledge them, and we're able to do something about it. I am able to accomplish my goals for myself. So that's also something that you kind of something that you have some self esteem and self meaning, because that's really important. You feel good about yourself, or maybe not if you don't feel good about that, right? I have personal standards and try to live up to them. So we're not talking about professional standards. Of course, that kind of comes with it, but personal standards are really quite meaningful. They stay with you. They can change, all right, because you learn. You. I wanted to say that I changed. What I was 20 years ago as a social worker, I am different now. And my standards evolved to something that's much more conscientious and meaningful in life. So here I know how I want to be. I have trouble making up my mind about things. These are the different indicators of your self-regulation. And I hope that you're able to go over this and maybe take a test on it. So self-efficacy, right? So you had self-awareness, self-regulation, and self-efficacy. That's also a very important component in our discussion, definitely, right? When you are self-efficacious, and there's um, one part that I use as a scale. Bandura especially has talked so much about self-efficacy as the theoretical framework. And here I am presenting this based on, let me just go and see here, based on self-efficacy theory. And there are different components. One is verbal persuasion. Do I have some ways of encouraging myself, right? And this is developing self-efficacy. Do I have the psychological makeup, such as emotional state for me to lift myself up, right? To be normal and to react normally as I'm thrown into the fire or as I get or receive some of these challenges, regarding my clients and my home family life, as well as life in general. And then the most important thing, one of the most important thing is the performance outcome. And I would correlate this with someone, and I'm going to tell you this. What if I want to be a marathon runner, right? I don't know how to do that, right? But marathon runners, besides actually exercising and doing all kinds of things to give them that time as well as the stamina to continue on, right? They're actually self-talking and also actually enacting, memorizing. How can I be successful? Like from A to Z, they know what to do. First, I'm going to do this, I'm going to do that. So, in other words, they're mentally giving themselves that set of skills, imagining how to be successful. And that will give them that performance outcome. But the most important thing is self-modeling. And how does that work? How it's like guided practice to independent practice. So you start off little by little, you run, you walk, and then you run for many miles within a certain period of time. Then you increase your level, your rate of experience in running, the stamina that you have, and so on and so forth. So, but the most important thing is actually enacting or acting upon that self-efficacy, acting upon that goal that you have. In other words, you can't just say, okay, I have that thought, great thought, and I have the will to do it, but have you acted upon it? So you have the will, you have the thought, the will or volition, and you need to, the most important thing is to act upon those activities and goals towards self-efficacy. Okay, so now I'm going to move to introducing to you the culturally responsive methods and interventions. As you can see in the background, I have several Western interventions, which you could probably peruse later on, as well as Asian or Filipino interventions. And I kind of want to put them parallel with each other just so you know the difference. But I want to highlight as interventions which have already been proven by science: yoga, Tai Chi, meditation, and spirituality or faith. Now, in the next section of my presentation, I will not go into specifics of these modalities, except for spirituality and faith, because I think it's one of the highlights that I should present to you, because of the fact that you are actually, so most of you are doing it, and that's steeped into our social work. As we know, social work has been founded, on religiosity and spirituality, right? So Tai Chi, yoga, and meditation are actually Eastern practices that have been proven. And just a little bit of revelation, I do Tai Chi and a little bit of yoga, and of course, meditation as much as I can. And these modalities have been proven as efficacious, for cancer patients, for people who are in pain, for people who have physical and mental illnesses. And there's enough studies for you to explore based on research. So I will discuss a little bit more the salience of spirituality and faith, because it's also a part of my dissertation. And one of the things that I have found in my study is all clients, this is American context, clients want their social workers and mental health practitioners to have spirituality, So that's really a revelation there, right? So when you talk about spirituality and faith, we cannot separate both, or we cannot also separate the idea that there are social workers who are not spiritual nor religious, right? But they have beliefs in some form of something about the universe and so on. People may not be religious but are spiritual, and people may be spiritual but not religious, right? So we need to think about it. So why is your religion and spirituality important, especially during the time of the pandemic? Right. So I want you to think about and explore this possibility, right? So why is it that I'm emphasizing this? Because of the fact that there are people in the world that maybe just follow the golden rule, right? Do unto others as you would like others do unto you. And that's kind of a spiritual realm there. And of course, even showing mercy and forgiveness, that is a spiritual attribute. So, why is this important in our pandemic? Because it's time for us to take a pause while we are sheltered in place and time to ask ourselves, what is our place in this time of pandemic? What is our uh, place in this universe, our role in this universe, so that we can function more normally within the limitations, the physical limitations that we have, right? And how will my spirituality or faith or something, my belief systems grow, okay, regardless of your affiliation? And that's good too. I mean, it does not have, we don't have a formulaic kind of intervention here. We, we want to show that these are important components to think about in times of pandemic. So you follow, right? This is, you follow what you believe in, you know, and I challenge you as you explore this realm of possibility with spirituality and faith or some belief system to be independent minded in your thoughts and not to be entrapped by what other people say or impose upon you about what you should do, because there are some people whose growth have been stunted because of what other people say or tell them to do. And I think that's dangerous. Okay, we need to try to have some independent mind, critical thinking skills, and this is a part of awareness, right? Independent thinking, it's a part of authenticity, which embodies yourself, okay, and your care, self-care, ability to understand about yourself. Not to say that you should not care about yourself, where you're at, but what's your place in the universe. And the clear your mind, the more you meditate and think about yourself, that spirituality, maybe that spirituality can launch it for you to become a better person. And with that reference point such as what you cling to, remember that poem, that song, that maybe a scripture, a saying, the revelations of religious scriptures, the Bhagavad Gita, the most holy book Quran, the um, Kitabiyak Tas, Kitabiyak Tan, Ikan, all these religious books may lead some way for you to understand that there is that spiritual realm that must be thought about when you are in the midst of this pandemic. And there is enough evidence that spirituality and religion really work based on emotional and spiritual support, that potential predictor of grit. You strengthen your outlook, positive outlook towards the disease, and you're also motivated to think of these events through some distinctive cognitive lens, which leads to positive outcomes according to research, right? Here are the more practical methods, you know, having a routine, getting up to and going to, you know, get up and go to bed at similar times every day. Guilty, you know, I'm having problems with that, right? Some problems that we have because of the time frame and the activities we have that have been changed. Exercise, keep up with your personal hygiene, make time for doing things that you enjoy, and you allocate some time for resting. Now, also media, social media and video use, you know, we sometimes we abuse this, and it's not good for our self-care. It's great to keep in touch with people, but at the same time to be much more moderate in our use of media. Alcohol and drug use, right? That's also another risk of of what we have here. Infections are much more for people with COVID when they have used alcohol, and there are more worse treatment outcomes because alcohol use, and alcohol and drug use may also prevent you from taking some sufficient precautions to protect yourselves against infections such as compliance to some things, right? There's help and support. Seek out the help and support of healthcare workers in your community, and mental health. Uh, and if you have some symptoms, try to seek friendship with, of course, your friends and family first, and then, of course, with your ministers, with priests, with anybody whom you think will be able to assist you initially until you meet someone who can give you a good diagnosis of what's going on. Now, I know I have COVID stories of Filipinos in the United States, and I also know for a fact that there are Filipinos that are serving right now in the Philippines with limited resources that have considered themselves that they may not survive this COVID because of those limited resources and so much going on with our medical facilities, medical people, the doctors and nurses. And in the United States, there have been a lot of Filipinos also dying of COVID. And not only the medical field, but they're helping, those who are helping in the elderly communities and institutions. And that is a sad state of affair for for Filipinos especially, and of course for Black and brown and indigenous people who are dying. And I kind of want to be a little bit more personal, just to make a point of my daughter, who is a COVID nurse. And she decided to uh, arise to the occasion and serve COVID patients outside of New Jersey. She decided to leave New Jersey because there are places, states that need social workers, nurses, and this is what she wants to do, right? So there are implications to social work practice, and I would like to kind of give you a brief rundown. And you can only do this if you're healthy, all right? You cannot function if you're not. So that's why you need self-care. But if you think about self-care, you have to think of on a macro level, all right? How you work with individuals, the grief issues that come on that are going to arise because of pandemic, the socioeconomic inequality that you must help fix, resilience and grit, and how do you, I know you appreciate it, but how do you influence your clients to really hang in there, right? Perspectives on the present and the future, and not looking at the past, because this is what we are now in real time. And the overall effective performance of your clients when they work, if they continue to work or they're at home. And of course, the other kinds of duties and roles and functions across social work practice. From the Metso perspective, you know that there are survivors, workers, elders, returning employees, even overseas Filipino workers that are critical to this issue of Metso groups of them who are coming back home to the Philippines, grief issues consistently, and then of course on a macro level, do you have what it takes to influence the policy right now as social workers, and how do you also distribute the services, considering that the community engagement is limited and of course the governmental support, the international community, because everybody in the world has been affected. And of course, how do you see the measures of checks and balance of power and privilege from those who have versus those who do not, right? When you mostly actually serve those who do not. So final thoughts for this. Let's be positive and hopeful for ourselves, for our clients and families and friends. Let's be a bearer of good news, because it's so hard to always bring bad news, right? I know we're realistic, but we also have to highlight those positive news. We start assessing our skills, look for opportunities. We continue to network even from home. And when sadness prevails, take out some of those invisible tools, those superpowers, those spirituality, mentorship, wisdom from from our ancestors, the mantra, the songs, the what would whoever do, right? What would my mother do? What would my mother say, right? And then change, but not only change for yourself, but to be a better person for others, and be Don't be too hard on yourself. All right? Good enough is good enough. This is the pandemic. Being hard on yourself is difficult. Don't have to be perfect, and you will make mistakes. However, just be good to yourself, because this is the time for you to take care of yourself so that you can take care of other people. In that regard, I believe these are the summary of what I have presented. And maraming salamat sa inyo. At daghang salamat kaayo, madamong nga salamat, magsukutuod kay mo, gracias, and Dios te admira, nakalat salamat, sukran. These are the dialects. There are over 70 dialects in my country, the Philippines, and I look forward to working with Filipino social workers again. And thank you so much for the opportunity. And I hope that all is well in your families and your communities are doing well and keeping safe. Marami pong salamat.